Repair of ectropion, suture. An ectropion is a turning outward of the margin of the eyelid. The physician administers local anesthetic and the patient's face and eyelid are draped and prepped for surgery. The physician uses absorbable sutures to foreshorten the posterior tissues of the eyelid in an effort to redirect the rotation of the eyelid posteriorly. No incisions are required for this treatment of ectropion. Repair of ectropion, thermocauterization. The physician administers local anesthetic and the patient's face and eyelid are draped and prepped for surgery. Bipolar or unipolar cautery is employed to shrink the posterior tissues of the eyelid margin in an effort to rotate the lid margin posteriorly toward the globe. No incision is made. Repair of ectropion, excision tarsal wedge. An ectropion is a turning outward of the margin of the eyelid. The physician administers local anesthetic and the patient's face and eyelid are draped and prepped for surgery. A section of tarsus and conjunctiva in the configuration of a diamond or rhomboid is taken from the posterior or back surface of the lower lid. Incisions are closed with interrupted absorbable sutures to rotate the eyelid margin posteriorly toward the globe. Repair of ectropion, extensive, e.g., tarsal strip operations. The physician administers local anesthetic and the patient's face and eyelid are draped and prepped for surgery. The physician makes an incision in the lower lid and isolates a tongue or strip of tarsus in the lateral 1/3 of the lower lid. Non-absorbable sutures are passed through the tarsal strip. The periosteum of tough fibrous tissue that lines the bone of the lateral orbital rim is isolated. The sutures from the tarsal strip are passed through the periosteum overlying the bone of the lateral orbital rim. The physician tightens the sutures. Eyelid margin tension and contour are evaluated and adjusted. The incision or incisions are repaired with sutures. Suture or repair of testicular injury. An incision is made in the scrotum to expose the testis. Any devitalized testicular tissue is removed by sharp dissection and the thick tough fibrous tissue encasing the testis is closed by suturing. The scrotum is closed in layers by suturing. Often a rubber drain is placed to prevent the accumulation of fluid and blood in the scrotum. Repair of tunica vaginalis hydrocele, bottle type. The physician makes an incision in the scrotum or in the inguinal area. The sac is opened high along its front surface and the testis is pushed up through the sac and out through the incision. This inverts the hydrocele sac, which is tacked by suturing to the spermatic cord structures behind the testis. The testis is returned to the scrotum and is anchored to the inside of the scrotum with 3 sutures to prevent later torsion or twisting of the testis. A rubber drain may be left in the scrotum and the incision closed in layers by suturing.